it's probably an underutilized treatment by pain management specialists in general. Because I think in some ways we need to think outside the box in how we approach patient care and the utility of our ability to manipulate the sympathetic and the nervous system in general. And if you really look at some of the best data that we have as pain specialists for what we do, is for the treatment of sympathetically mediated pain syndromes, particularly with neuromodulation. This is something as well that really to just drill in to, if you're going to use this approach, you have to align the end plates. In addition, you have to align your midline. Because if you don't align your end plates, you don't know what part of the spine you're looking at. And you can confuse the view where you have the lamina and not see those lines there. And that's when especially you have the chance of going into a disc.